it sounds like you're describing is an injury to the nerves that go to the skin. So you've got motor nerves and sensory nerves. Sensory nerves go to the skin to give sensation. And so you do have small sensory nerves that run in the fat, just under the skin, that either get temporarily injured, so a neuropraxia, which is like a bruising of the nerve, which causes a temporary loss of function, or if those nerves get cut, then you get a permanent loss of sensation. And with loss of sensation, it's not necessarily just a pure numbness, and it's not numbness to everything, so deep pressure is not something that you get numb to, but sort of light touch and vibration type senses can be lost. If you get that, you can also get a discomfort associated with it, so this sort of numb, itchy sensation that it doesn't matter how much you try and scratch it, it just never goes away. So, in terms of that potential problem, absolutely, that is a potential issue with any of these procedures, because we're resecting big amounts of skin and fat, and there are going to be nerves that pass through that operative site that are going to be affected. So I think it goes back to being properly informed, so at least it's not a surprise that happens. Being followed up properly as well, so the post-operative period is important, and the follow-up is not just 6 weeks and then 3 months or something. It's years later. Not just for those issues with the nerves, where a lot of the time it does settle down as time goes on and the nerves recover. But in terms of follow-up, it's also looking at your scars and looking at the changes that continue to occur after surgery, because things soften and loosen as well. So initially after this sort of surgery, everything's really tight and taut, and that's great, but things loosen really quickly. And so oftentimes for us, it's a balance between trying to make things as tight as possible, knowing that it's going to loosen in the following months, but also making it not so tight that, worst case scenario, you can't close a wound. So I have heard of those things happening where people have not been able to close a wound because it's so tight. But obviously the tighter it is, the higher the risk of infection, for example, or slow wound healing. So and that's where the judgment comes into it. It's not an exact science.